Hi, good evening, everyone.
Good evening.
Good evening, everyone.
Good evening.
Hi, thank you. Hi. Thank you so much, Frederick County, for having us tonight. My name is Emily Keller. I'm the Special Secretary of Opioid Response for the Moore-Miller administration, and it is an honor and a privilege to oversee the Opioid Operational Command Center, or what we call the OOCC. So we're here tonight on our town hall series, and a little later I'm going to go more in depth as to what the Moore-Miller priorities are and what our office does, and then I'm going to turn it over to you because we want to hear from you. But first, we have a couple speakers here tonight, so I just want to introduce to the podium Jonathan Pastor, who is speaking on behalf of Congressman David Trone. Jonathan?
Hi, everyone. My name is Jonathan, and I'm with the Office of Congressman David Trone. I have a brief statement I will read from the Congressman. Thank you to the Opioid Operational Command Center for inviting me to your opioid town hall in Frederick. And a special thank you to Secretary Keller for all of the hard work you've done to end the opioid epidemic in Frederick and now across Maryland. The opioid crisis has plagued every community in every corner of our country. In the last 2 years, over 150,000 people have died of an opioid overdose. That's the equivalent of a jetliner every single day. Today, I would bet that everyone in this room knows someone who died of an overdose or is currently fighting substance use disorder. This issue hits close to home because in 2016, I lost my 24-year-old nephew, Ian, to a fentanyl overdose. So we need town halls like the one here today to educate people on the crisis, improve access to resources and treatment for people in recovery, and to create innovative solutions so we can keep our communities safe. As your congressman, I'm not in the business of lip service, I'm in the business of action. Together we can make real change. Thank you and stay safe.
Thank you, Jonathan, and thank you to our congressman who's been a true champion to this issue from the day he took office. We appreciate all the work that he's done. Up next, I would like to bring onto the stage the Frederick Community College Vice President for Talent and Culture, Bridget Cofield, and just use this opportunity as a chance to say thank you for all the help that Frederick Community College has given us in putting this together. Thank you very much.
Good evening. As stated, my name is Dr. Bridget Cofield, and I have the pleasure of serving as the Vice President of Talent and Culture here at Frederick Community College. It's an honor for us to host tonight's event on the Community Overdose Action Town Hall Series for Frederick County. On behalf of President Anissa Cheek, I am delighted to welcome leaders from our state and county, and we thank them for the important roles they play in combating the opioid and overdose crises in our communities. This work is something that we as a college take very seriously. Many areas across campus are engaged in increasing support for students in battling substance use disorders and preventing overdoses. Our focus in particular has been ensuring Narcan is readily available in areas across campus and training as many members of our community as possible on how to administer Narcan if needed. We also work closely with many community partners to connect students and employees in a variety of ways to the resources and services they may need. We know there is much work that can be done preventing overdoses and supporting our community members who have substance use disorders is a significant challenge that requires many individuals and organizations working together. We also know it's a crisis that touches every community and many families within all of those communities. We are committed to helping in that fight and stand ready to work with our partners in any way we can to save lives and protect our future. Again, welcome to Frederick Community College, and we thank you for your shared commitment to this critical and significant work.
Thank you very much, Dr. Cofield. Appreciate you being here. It is now an honor and a privilege for me to introduce your County Executive Fitzwater. I met Jessica. Yeah, she deserves that, but it's okay. I met Jessica several years ago, and she has just been a true champion for Frederick and Western Maryland. So I'm happy to be able to stand here and call you a friend, and I'm more excited to call you the county executive. It never gets old to say that. So thank you for being here, and welcome.
Good evening, everyone. Thank you so much, Special Secretary Keller and your entire team, for visiting Frederick County as part of your Community Overdose Action Town Hall Series. We are coming together to face daunting challenges with hope for a brighter future through education and action. As of September 30th of this year, in Frederick County, there have been 116 non-fatal overdoses and 27 fatal overdoses here in our community. Opioid overdose is the leading cause of death for people under the age of 50 in the United States, and it requires solutions and partnerships from all levels of government in order to face these challenges. It requires a care continuum that serves people where they are and when they need the help. Frederick County has been working for more than a decade to build a comprehensive, accessible, and culturally sensitive system of behavioral health care. We're investing in this infrastructure and these partnerships in many ways, including our crisis call centers, 211 and 988, of which we're so appreciative to partner with our Mental Health Association. We've expanded our mobile crisis services as well as residential crisis housing. We have today opened what has been in the works for many, many, many months and working along so many levels of government, our first ever 24/7 crisis care center here in Frederick County. Please give a round of applause for that. We're so excited. We actually had the opportunity to host the secretary a few months ago, and she got to see the building as it was in progress. And it's been incredible to see how our partners with the Mental Health Association, the Health Department, our state and federal delegations, including Congressman Trone, who has been essential in helping us get the funding for this project, our own county staff and our Department of Public Works that helped keep this project on time, to finally be able to open the doors and to really remove barriers, because no matter what day of the week it is, no matter what time it is, there is help, there is support. Our building is on public transit lines, there's parking, it's accessible, and we want people to know that help is available no matter what the crisis and no matter what the time. We also have our Coast partners with us here tonight. This is our overdose peer outreach that we do with our community paramedics, which has also been a key in helping us to reach people where they are when they're in crisis. Frederick County places a great importance on community and agency collaboration, ensuring that our system of care is built around the needs of the people that we serve every day. Our local behavioral health authority has also been proactive in conducting landscape analyses and collecting and analyzing data, seeking out funding sources to launch innovative programming that meets the needs of our community and helps us also meet the goals of our state and federal partners as well as us locally. We continue to integrate our behavioral health services, build system capacity, combat stigma, and enhance local collaboration, because that's really how we're going to get things done. And we say this all the time in Frederick County, but it's really our partnerships that make this a community a special place. So I want to take a moment to recognize some of the other elected officials that are here. You already met Jonathan representing Congressman Trone, who again has been a key partner along with the rest of our federal delegation. But we also have some of our state partners here. We have some of our delegates from our state delegation. We have Delegate Ken Kerr, who is here tonight. Delegate Chris Fair. And also Delegate Karen Simpson. One of my colleagues in the county government, our county council member, MC Keegan-Air, is here. Thank you, MC. And we also have council member Renee Knapp, who's here from the county council as well. Thank you, Renee. And I'm pleased that the mayor of the city of Frederick, Michael O'Connor, was also able to join us tonight. Thank you, Michael. I hope this shows you the investment that we have in Frederick County to making sure that we're meeting residents where we are and continuing to build a robust social safety net for all of our community. And we have some exciting things coming up as well. On Saturday, we're doing our Drug Take Back Day. We'll have 2 locations this Saturday, the 28th, both at the Frederick County Health Department and the Law Enforcement Center on Airport Drive. You can also return syringes and sharps during this event. And tomorrow night, we're so excited to be partnering with the health department, with our Frederick County Public Schools and Safety Blitz Foundation to sponsor a Friday Night Lights Against Opioids. We're going to be at multiple high school football games tomorrow evening, and I'm so excited that the Lieutenant Governor is going to be joining us at one of the games to really show that from the state on down to our county and to our municipalities, that we are committed to communicating this message, to fighting against the stigma, and making sure that educational resources are available. We'll be sharing those resources as well as prescription disposal packets at the high school games and information for families about designer drugs and how to recognize what they're seeing and what their children are seeing. We know thank you, we're excited. October is Youth Substance Use Prevention Month, and in Frederick County, data shows that underage drinking and substance use remain not just national public health issues, but also local public health issues as well. Our most recent youth risk behavior survey showed that over 13% of FCPS students reported using prescription pain pills without a doctor's prescription, and almost 25% of FCPS students reported drinking alcohol, with 21% of seniors reporting binge drinking 4 to 5 drinks in a row in the last 30 days. So it's important that we talk about this, that our students and our kids know that they have our support and that it's okay to ask for help and to ask questions. So again, thank you to Frederick Community College for hosting and co-sponsoring this important event. And thank you again, Special Secretary Keller, for being a part of bringing this to the forefront and to coming out and listening so we can all build solutions together.
Thank you.
And I even wrote it down. I am very privileged to introduce our next speaker, which is Dr. Barbara Brookmeyer. Dr. Brookmeyer is Frederick County's public health official and an incredible partner along with her team in the work that we're doing here.
Thank you, County Executive Fitzwater and Secretary Keller. This is an exciting night. In order for me to keep on time, I'm going to have to read from my script because when I go off script, I always take too much time. So I do want to share with you a brief, that chuckle was from people who've been there and sat through it. So I do want to provide a brief update on some of the services that are available in Frederick County in behavioral health services, but it's certainly not all of them. Oh, yes, and I've got a clicker too. Okay. There we go. So the health department includes the local health behavior, the Frederick County Health Department includes the local behavioral health authority, which is responsible for planning and managing and providing quality oversight for the public behavioral health system. So this includes programs, both private and public, that accept public dollars in any way. So for example, providers who accept Medicaid payment. So the local behavioral health authority provides a continuous landscape analysis and gap analysis, and we work with our local, state, and federal partners to provide and procure innovative programs and address gaps in our community. So examples, let me go back, yeah. So examples of the programs, you can see that there. Some examples that have been launched and overseen by the local behavioral health authority include the Mental Health Association's Crisis Walk-In Center, which you heard about already. That's combined with the Crisis Stabilization Center. And the Marcy's Choice Inpatient Facility, which is affectionately known as the Detox Facility. That's what many referred to it a couple years ago when it opened. So here are a few examples of the programs that we implement for prevention, screening, treatment, education. These include the Suicide Prevention Coalition for Frederick County. So we do have a Suicide Prevention Coalition if you want to get involved, as well as substance use disorder treatment, reentry, and case management services for those individuals at the Frederick County Adult Detention Center. So here's a brief list of our recovery support and outreach services, as well as our harm reduction services. We've got 17 full-time equivalent peer recovery specialist positions, and they're embedded in numerous agencies across the county. You can see the list there. We also have partnerships with Johns Hopkins to provide treatment for hepatitis C and to prescribe buprenorphine for our program participants. We are really proud of our peer recovery specialist programs, and you can see the variety of locations where our peers are embedded. They provide services such as connection to treatment and health services, recovery center programming, overdose response training, Narcan distribution, and fentanyl and xylazine test strips. They also assist with obtaining vital documents, health insurance, transportation, as well as just being there and providing in-the-moment support. They're meeting folks where they are. So our harm reduction program was launched in 2018, and the program is known as the Street Safe Program. It's a comprehensive harm reduction program that offers supplies, infectious disease testing, and referral to medical services for people who use drugs. So research demonstrates that people who participate in a syringe services program are 5.5 times more likely to enter treatment than those who do not. This program was recently evaluated by researchers from the Johns Hopkins Bloomberg School of Public Health and shown to be effective in providing support, wound care, and access to treatment and other needed services. So great job, team. This program is an approved program with the Maryland Department of Health, offering legal protections for staff, volunteers, and participants. And it's staffed by our peer recovery specialists, a nurse, and other trained harm reduction staff. So we've also been on the forefront of street drug testing for many years. Before anybody talked about it in the news, we were the first to detect xylazine in the drug supply after community members reported unusual side effects and serious wounds, including necrotic or dead tissue. Then the Maryland Department of Health formally launched the Rapid Analysis of Drugs program, and Frederick County has been participating in that program since November of 2021. This program allows participants in our syringe services program to submit drug paraphernalia for testing. At the health department, we swab samples, which are then sent to the lab for testing, and it allows us to have real-time knowledge of the drug analysis landscape right here in our own community, and also throughout the state of Maryland. So this graph here, this chart, shows the variety of substances found in street drug samples in Frederick County. You can see fentanyl made up 43% of the samples, cocaine 31% of the samples, xylazine was found in about 22% of the samples, and almost always as an adulterant and not found alone, though. Most samples contain more than one substance, and common adulterants are quinine, the xylazine, mannitol, and caffeine. So this is what we actually call our external organization chart. And it shows the numbers of boards, councils, work groups, coalitions, and policy groups either led by health department staff or health department staff serve on it. We've got unprecedented program and agency coordination in Frederick County, as has already been mentioned multiple times, and it's one of our greatest assets here in Frederick. The health department also leads the Overdose Fatality Review Team, and this team reviews overdose deaths with the goal of trying to identify what may be contributed to those deaths that we could possibly prevent in the future. And it leads to identifying system level and policy level changes, and we make formal recommendations to the state to implement programming to address that. So one of the things was the group identified that the hospital drug testing did not include fentanyl. And subsequent research by our staff found that among the 83 hospitals in the DC, Maryland, Virginia area, many of them did not test for fentanyl. So Frederick Health Hospital, the great partner that they are, upon learning this, immediately took action to remedy the situation, and now fentanyl is part of the drug testing. Thank you, yes, because it was a significant one, because if the drug test results did not show fentanyl, then the clinicians didn't know that there was an opiate that warranted treatment management counseling related to opiates. So it was pretty significant. So I'm very excited, and this is our next speakers coming up, and in fact, they can start walking up. I would think that LEAD is our newest harm reduction initiative. It was launched in January 2022, and in Frederick, LEAD's a pre-booking diversion program that diverts people out of the criminal justice system and into long-term harm reduction street-based case management. So it's a partnership, and so you'll hear later, just after me, about another partnership, but this partnership is with Frederick Police Department, the Health Department, the Mayor's Office, City of Frederick, State's Attorney's Office, Office of the Public Defender, and the Division of Parole and Probation. So we serve people with unmet behavioral health needs, people who are homeless, people who are experiencing chronic poverty, and with the goal of reducing their involvements in the criminal justice system and connecting them to other supports that can improve the quality of their lives and reduce their interaction with the criminal justice system. So diversion can only be offered on nonviolent, low-level criminal offenses, and it's limited to Frederick County residents. We also provide case management services. Oh, I was jumping ahead. I actually still have Kids Like Us. So Kids Like Us is a free Frederick County Public School-based program for both middle and high schoolers whose lives have been impacted by substance use, incarceration, and/or mental illness. The Frederick County Health Department and staff at FCPS work to identify students in need, and we've just concluded a 10-year longitudinal study on the program's efficacy and effectiveness, and we are pursuing publication in several journals about that. So great job, team, getting on that evidence-based list. And academic detailing, so we have a very successful academic detailing program in which health department staff work with prescribers, so the prescribers to enlist them as agents of change in the behavioral health of their clients. We ensure local providers have up-to-date information on prescribing best practices and information on overdose response training. Also, HIV and hepatitis C testing, and information on the local Adverse Childhood Experiences Work Group, the Kids Like Us program that I just mentioned, and other harm reduction services. So we're so successful that we were actually responsible for 20% of all academic detailing visits in the state of Maryland last year. So our little program and our very dedicated staff member working on that, 20% of all the visits in the whole state were done by Nate. Great job, Nate. Wow. Okay, so here we've got the continuum of care. So this slide, I wanted to share this with you. It was created by our partners at the Mental Health Association, and it demonstrates our crisis system of care. And this continuum addressed the immediate acute care need. The left side, the left side is the least restrictive service, and it includes the call center. And as you move to the right, the services become more intensive and involved up to inpatient at the hospital. So not shown on this slide are the crisis shelters for domestic violence, such as Hartley House, but they are certainly a critical part of our infrastructure with both a shelter and 24-hour hotline. So it's critical that for more urgent needs, our system needs someone to call, someone to respond, and somewhere to go. And speaking of that, someone to call, someone to respond, now I really do mean to bring up the next folks who are going to talk about the COAST program. So Chief Co. and Michelle Marshall, our Supervisor of Peer Recovery Services. Please.
Thank you to the OOCC. Thank you to Secretary Keller and County Executive Fitzwater. It is truly an honor and a privilege to be here. My name is Michelle Marshall. I'm a peer recovery supervisor for the Frederick County Health Department and the peer outreach response coordinator, responding to all overdoses, as well as the supervisor for the COAST program for all of our peers. And I also am a woman in long-term recovery from opiates.
And my name's Tom Coe. I have the honor and privilege of serving as Frederick County's fire chief. And the Frederick County Fire Service is so honored to be in this partnership with our health department to help our citizens who are struggling get the services they need when they need them, where they need them.
I have the clicker now. So the concept for our partnership was born out of a series of events that occurred here at this hotel. A male subject was encountered by EMS 3 times in 24 hours for overdoses. By the time the referral had been made to peer recovery specialists through existing channels, it had been several days, and the person was not able to be contacted. We began to ask ourselves, what if we could have intervened sooner? But we did, didn't we? We actually had EMS crews on scene. The person was administered Narcan. So we began asking ourselves, what if we sent different resources in addition to our EMS crews? It felt as though we had sent a fire engine to a fire without water. The result was a conversation between myself and Matt, who's here. And those who don't know Matt, it was a very long conversation that took days. But we went back to the conversations, and we had conversations with our respective leaders. We presented to them our plans, and we were able to demonstrate a value and a need in the community, which everyone embraced and supported. During that time when Matt and I were having conversations, he was very open to hearing my story. And part of my story was in 2010, when I overdosed, my driveway was completely lined up with Frederick County Sheriff's Office and EMS crews. And I say my driveway because it's a mile long. That day, we talked a lot about what happened, and the 2 things that I remember the most about were I was in the back of the ambulance, and the EMS provider said to me, "You're so lucky to be alive." And that was so compassionate. I had a great experience with them looking back. And the Frederick County Sheriff's Office, they said, "You're not in any trouble." And I couldn't speak at that time, but the only thing that I thought to myself was, oh my gosh, I don't want to be alive. I don't want to live like this anymore. And I'm in so much trouble, I'm actually going to lose custody of my son. So all these things were going through my mind, and when we were talking about a peer recovery specialist being on board with EMS, it was the perfect matchup because we were able to respond to that call and have that one addict helping another. It's an unspoken language, and it's that comfortability that allows someone to open up immediately. Oh, clicker. This is our COAST team, and we have recently expanded. To your left is going to be Jeremy Galvin, who is the community paramedic for GFRS. That's Sam. She's a peer recovery specialist. She's based out of Frederick Health Hospital and also the COAST team. There's myself, and there's Jenna Smith, who is down to our left. She's also here. And then there's Matthew Bergen, who is community paramedic for the Department of Fire Rescue Services. That was a recent picture. We recently expanded. So our pilot program began in the pandemic. Couldn't have picked a better time, but what we found was that it allowed us to measure the need of our most vulnerable population and to absolutely define the necessity to bring services directly to the person on scene. As many programs and services were halted temporarily and less individuals were being transported to our emergency, sorry, my mouth is getting dry, to the emergency department due to fear of the pandemic. So we knew we had to get face-to-face with people to actually offer them services at the right time in the window of opportunity that we had.
So COAST Partnership originally started at 8 hours a week, and our peer support specialist, or peer recovery specialist, and our mobile community health paramedics were out on the streets of Frederick County responding to overdose-related calls. Not only would we provide initial immediate emergency medical services, but our peers would really connect with the folks who were struggling to connect them to services that they could as they were willing to accept them. So as we started with an 8-hour-a-week program, we saw the immediate benefit in the connections we were making. We expanded to 16 hours a week. And you can see in 2022 of the numbers behind me that our increased contact with patients yielded a significant number of positive results in patient contacts and connecting them with services.
Thank you.
I did not click it.
That's okay. So 130 doses of naloxone were distributed during this time and 140 fentanyl test strips. We were trying to saturate the entire community with this life-saving medication. Something we found during our response is that we were able to actually train, refer, and connect other people on scene, which was like a side effect of what we thought was going to happen. We thought we were going to go out there and actually just treat the person who overdosed. What we found that when we went on the scene, we were actually able to talk to the people, talk to families, provide them with services and supports that they so desperately needed.
So this absolutely solidified the need for the COAST program to bring needed resources and services directly to the persons using drugs. Stigma played a large part in people not accessing services. Showing up on the scene and treating the individual with dignity and respect and withholding all judgment. Meeting them where they are, offering a full menu of services is essential to combating addiction and the opioid crisis. We must run into the fire as a community and as a partnership.
So then we took it a step further. We analyzed how many people we encountered and were indicated for a referral. These are the participants that the COAST program team felt would truly benefit from a referral to treatment or other resources in the area. We have such a great community, and there's so many different resources here in Frederick County. We are very blessed and very grateful for all of them. So as you can see, out of the 118 people that we encountered on scene, peer recovery specialists felt that 94% of them could have benefited from a referral to treatment or other resources. 6% did not. They didn't meet criteria for any type of resources. Now, what was great about this, that actually 73% of the 94% that we indicated needed a referral accepted them. And 27 people did not. But we were still able to, it's all about building the relationship with people. Mm-hmm. It is the most important thing. Not everyone is going to want treatment when we show up on the scene. The most important thing, like Chief Coe said, is to not be judgmental, love and compassion, build that relationship with a person so that they're going to reach out to us later. The next thing that we found was we encountered a lot of co-occurring factors. 67% reported mental health conditions, 17% reported homelessness, and 3% reported being a veteran. And I'm so thankful to the new veteran services that we have in Frederick County today, so we're able to refer.
So we spent some time talking about what COAST is, but let's talk about where COAST is going. So fortunately, because of some grant funding that we've been able to acquire, COAST is getting bigger. So we're moving from 16 hours a week to a total of 40 hours a week in January of next year. And that's going to allow us to reach so many more people in their time of need. But it doesn't just stop there. Our grant funding is allowing for additional training specific to addiction services for our first responders. And it's also going to assist in funding both scholarship and transportation vouchers to those in need of getting services that they might not be able to afford. Additionally, Frederick County is incredibly proud to be one of the first EMS services in the state to be able to provide buprenorphine. So we know that we're excited about that too. So we know that sometimes we can't get folks into treatment immediately. And this buprenorphine ability in the street is going to allow us to bridge that gap so we can get those folks to the appropriate services that they need. And we really think it's going to be a key to success in this program moving forward.
And that is all we have. Thank you so very much for allowing us to present. Thank you.
Thank you both for everything that you do and for all of the programs that the health department does and that you guys have here in Frederick. It is totally incredible, the work that is being done here. So thank you very much. Before I begin, I just wanted to acknowledge one last person who is here today, and that is Nan Mann with Senator Van Hollen's office. Thank you for joining us today. Thank you. So again, My name's Emily Keller. I'm the Special Secretary of Opioid Response. And what does the OOCC do, right? How did we get here? How did I get here? So thankfully, Governor Moore was elected in November, and he sat down and was looking at substance use issues and decided that there had never been like a cabinet level position that reported directly to the governor, and he wanted to make sure that this issue was on the forefront of his administration. So he created this position. I actually previously was the mayor of Hagerstown, before that a city council person for the city of Hagerstown, and I ran on this exact issue. This was the only issue that I ran on because I never wanted to be a politician. No way. But my best friend Ashley struggled with a substance use disorder, and I watched her for years just fail. The system failed her, and she was treated like a criminal. She didn't need jail. She needed help. And I got frustrated, and I looked around in Western Maryland and said, what are we doing? And I figured I had spent many years sitting on the sidelines complaining, so I was going to throw my hat in the ring and try to do something about it. And thankfully, it resonated with the citizens of Hagerstown. Unfortunately, Ashley lost her life to an overdose, and what was the worst day of my life became the fuel to my fire, because I made her promise that I would be loud for her and that I would give a voice to the voiceless, and that's what I hope I'm doing, and I plan to continue doing. Thank you. I share her name all the time, and sometimes I feel like people are probably getting really tired of me talking about her, but I think saying her name is important because we lose 7 Marylanders a day to an overdose, 7 a day. And that's our friends, it's our loved ones, it's our dads and our moms. And we look at these statistics, and I think a lot of times we get caught up in the numbers and we forget that those numbers have faces. So this is my heart's work. Thank you. And for all of you guys that do this every day, God bless you. Thank you. I just want to talk real high level about the Moore-Miller administration's priorities and what, as my department coordinates the state strategic plan, what we're going to be focused on. So the first one is prevention. I think that's pretty obvious. We want to start at square one. But we want to focus on addressing trauma and adverse childhood experiences and promoting school-based and after-school youth programs so we can try to prevent substance use disorder before it starts. We also are going to focus on harm reduction, and this is something we're excited that this administration is making a priority. We know that meeting people where they're at is what we need to do. So we want to make sure that every single Marylander is carrying naloxone. How many of you guys carry naloxone? Awesome, I love to see that, thank you. We also want to expand access to wound care, syringe services, and drug checking initiatives like the RAD program that the doctor spoke about earlier. We also want to focus on treatment, making sure we have beds available when people are ready to get help, but also promoting equitable access to care through transportation services, telemedicine, increasing access to medications for opioid use disorder, and promoting care coordination. Next is recovery. We want to support the long-term success of people in recovery because we know someone entering a treatment facility for 28 days is not the end of the problem. We want to make sure, thank you. We want to make sure that Maryland is a place where people in recovery can thrive. So that is promoting employment in recovery and recovery-ready workplaces, increasing compensation for peer support services, and promoting things like recovery high schools that you here in Frederick are lucky enough to have. And our last pillar is going to be public safety. We know that our public safety officials are often the first to come in contact with people who are overdosing or people who are in crisis, and that they can create that care coordination that we so desperately need, while providing treatment and recovery services for individuals who are incarcerated as well. So some of our priorities focus on promoting alternatives to arrest and incarceration, like LEAD or law enforcement assisted diversion, promoting treatment and recovery services in detention facilities, and expanding reentry planning services and care coordination upon release. So that is not an exhaustive list by any means. I would be here all night. That was just a very high level of things that we want to look at. And our team coordinates with all 24 jurisdictions to come up with the state's response to the overdose crisis. That's why we're here today. So when we did our strategic planning session several months ago, I said, well, if we're going to coordinate for all 24 jurisdictions, we have to go to all 24 jurisdictions. So here we are. Okay. This is number 14 out of 24. And when we first started, we were announcing kicking this off. I kept joking, like, please pray for us because we're not going to sleep. Quite frankly, I don't think we have slept, but it has been so, so rewarding to hear from every part of the state. So I'm asking to hear from you guys and just to hear what's working, what's not, what the state can do better, what you need from me, and then we're going to take that back and work with all 24 jurisdictions and all the state agencies to make sure that instead of Maryland being the 7th worst in the country for overdose deaths, that we're the best. We're number 50. We want to be leading the way and not in the position that we're in now. So I'm going to turn it over. We have several folks signed up for public comment. I ask that you try to limit your remarks to 2 minutes. I'm not going to buzzer you out or anything, but we have a lot of folks to get through. I want to be respectful of everyone's time. And before I do that, just one last thing. I want to acknowledge 2 folks from the OOCC team here that are here today, Avery and Cassie. Thank you guys so much. And this has been a lot of work, for sure, to pull together a lot of coordinating and who's driving where and where we're going to stay and what venues we're going to use. And we're thankful for Frederick Community College for making it so easy on us for being here. So I'm going to sit down, start reading the names that are signed up. And then if you just want to come up to the microphone up there, and you'll have 2 minutes, and we'll go from there. Thank you, guys. All right, up first, to sign up to speak today, we have Kate Mathenge. Sorry if I said that wrong. Is Kate here? Okay. LaDonna McLean. Diana Ray. I didn't see Jamel. Jamel Freeman? I think he's here. Eileen Brewer. We can't go 6 in a row. This will be like a record. Kathy Missel. I know this person's here. Karen Miller.
Hi, everyone. I'm Karen Miller. I'm director and co-founder of Maryland Heroin Awareness Advocates. I also work for the state's problem gambling program. Thank you, Emily Keller, for coming out here. You've just been amazing since the day I met you. Thank you to the county executive's office, always very supportive, and Frederick County Health Department. You all know me, so I've been with you all a long time. Thank you for everything that you do and the 360 that you made to support the recovery community. Dr. Brookmeyer covered my original topic, so I had to write something real quick. You did a great job updating everybody, especially on the xylazine topic, because it's so dangerous. If you don't know what it is, please Google search it. It is very dangerous out here. Anyway, I have been doing this type of work for 13 years. I'm not only director of that nonprofit, which is a boots on the ground nonprofit. I'm just going to share some resources right now. Also, Save Our Children has been in Frederick County for 13 years, and we meet every Tuesday. And anybody and everybody are welcome to come to that meeting. You can reach out to me for information on that. We also have a location in Hagerstown now. Our funding comes from generous community fundraising efforts, and we provide food, clothing, short-term housing, transportation, and just recently we've been supporting people to get dentures who have had drug addictions. Please, by all means, use our services. They're free, and I can help you understand what your family might be going through. I've worked with thousands of people around the state and beyond to help. We also put up the signs at the detention center and the 2 that are up on 15 North. We went through the CE office back in 2014, and Jan Gardner was kind enough to support us on that mission, and that also came from community fundraising efforts. And anyway, we practice and encourage harm reduction practices, and we meet people where they're at. We support the families. recovery is possible, and my son and my husband are proof of that. We have been through a lot over the last 18 years, both in recovery by the grace of God. We lost our nephew to this disease. So Frederick County has the most amazing recovery community. I'm proud to live here, and a lot of boots on the ground organizations out here to help. And thank you all for your support, your dedication, and your commitment to the population we serve. Thank you.
Thank you, Karen. Thank you. Next we have Akaya Billups. Akia, sorry. Here? No? Okay. I don't know how to say that. Any idea how to get that one? Kate? Jungu? I don't know. Jungu? Sorry, I hate pronouncing people's last names wrong, so I apologize if I pronounce your name wrong. Christy? Is there a Kate and Christy here? Christy? I don't think that's, oh, she's, that's a different, yeah, that's okay. That's okay.
Hi, I'm Christy Kalbach, and I work at the Mental Health Association, and I'm very proud of the crisis care that we've got that was started off today. And I also volunteer with a group called On Our Own of Frederick, and we are peer-led recovery. I was thrilled with all the presentations today and the emphasis on the importance of peer recovery support. And that story you told, all of you, about how just speaking with someone who really gets it is so important. And I have to say, I want to thank the health department for the grant that you supply us with, as well as the opioid response, the Opioid Operational Command Center, OOCC, for your grant also, for helping us to expand our work and helping address the needs of those who are suffering. One of the things I wanted to share is yesterday, On Our Own is a drop-in center, and we're right downtown, and we provide a safe environment, non-judgmental, where we provide programs, one-on-one peer support, and social activities. And we went bowling yesterday with a group of about a dozen people, and it was a lot of fun. And as we were driving over, I was talking with two of the individuals in the car who were there, who both happened to share that they had some mental health issues, but they also had addiction issues that they were trying to overcome and were in the treatment programs. And they had said how Frederick was becoming known as the place where you could go and get the non-judgmental help you need to succeed. My concern, and the concern of a lot of people, is that whole idea of trying to receive treatment that keeps you in recovery for just 30 days. And is there some way we can provide stopgap funding, or what can the governor's office do to help increase the amount of days that people can stay in these recovery programs, do you suppose?
Well, this has definitely been a topic of conversation, especially with the opioid restitution fund money coming in. The state of Maryland is getting close to $500 million over the next 18 years, and that number is growing as more settlements come in. So we're looking at using those fundings to support recovery housing, support treatment, support longer efforts, and it's something that my team hears about very often, because like I said earlier, we know 28 days. I think gone are the years where we thought, hey, go here for 28 days, come out, you're going to be fixed. Right? We know that that's not how this works. So we are looking at different funding streams, whether that be through federal grant funds, whether that be through our office or whether that be some of the opioid restitution fund money that the state is going to see. A lot of that money is going direct to the municipalities and localities that participated, but some of it is also coming direct to the state as well. So we have to spend that money by a set of guidelines, but thankfully they are very broad as long as it is helping people with substance use disorder. So we're looking forward to that being a topic of conversation over the next several months. The first report just went out to the governor this morning, actually, and we will be making recommendations from the advisory council to the governor and secretary as well. And then, so stay tuned.
Great. That's good news. Thank you.
Thank you. Right, Carmen Lewis. I didn't see Jessica. Jessica Nicholson. Barbara Pinnock. Yeah, you don't have to speak if you don't want to.
I was like, I'm surprised if she doesn't.
Hi, everyone, and thank you all for being here today. I don't know if I got signed up to speak or what, but my name is Barbara Pinnock, and I'm nervous, of course, because this is like the first time this ever happened to me. Never spoke in front of officials, you know what I mean? So I'm a person of long-term recovery, and I moved here from New York, and I retired from Montgomery County government. And I'm on a mission right now because I'm a person of long-term recovery, and I'm starting a grassroots organization for women and children transitional living here in Frederick. And what it is that we talked about it just now. You can't get clean with just 30 days. And then we're dealing with the crisis of ACEs, generational ACEs, because I'm still in it and I'm coming out of it so I can understand what it means for a woman to actually get clean, take care of her children, raise her child very well, get a career, because I'm one of those women. I actually did it, and thank you. So because I'm a grassroots organization, I need funding. And I heard you just mention it, so I'll just sign up and do what I have to do. But that's what I have to say to you today. And thank you for letting me share.
Thank you. Thank you for what you do. Karen Simpson.
I'm here, but I didn't plan to speak. I plan to listen.
Okay. Thank you for joining.
Absolutely.
Mina Soleimani. Jessica Johnson. Catherine Mathane. All right. Well, that was all that was signed up to speak. I'm sure we can stay a couple minutes. Is there anyone else who didn't sign up to speak that would like to add anything?
Hello, thank you all for your time tonight. So I'm a child of a deaf adult. I have deaf parents. I was wondering what the state of Maryland is doing to address this crisis among its deaf population. Frederick does have a very large deaf population, with Maryland School for the Deaf being here. Across the country, there's only 4 centers that are accessible for deaf. I was just wondering if you all are thinking about providing interpreters or funding specifically for your deaf constituents in Frederick.
Thank you very much for that question.
Thank you.
I'm meeting with the Secretary of Disability very shortly, within the next month, and tomorrow they are actually hosting the first Deaf and Hard of Hearing conference that is specific for opioid use disorder. So it's an all-day virtual conference that I will be attending, and I hope to learn a ton of information about what we can do to address that. So absolutely, the answer is yes.
Thank you.
Thank you. anyone else that would like? Delegate?
Good evening.
Good evening.
Delegate Chris Fair, but I'm here speaking today as the Executive Director of the Frederick Center, which is an LGBTQ resource, education, and outreach center. The Youth Risk Behavioral Survey was mentioned earlier by the County Executive. I really appreciate any time that that document is brought up in a public space to remind folks to read into that data. I think it is critical to note that lesbian, gay, and bisexual people are 2.5 times more likely to have substance use issues and challenges facing them. Transgender people are 4 to 6 times more likely to be suffering from substance use and be in current recovery. My comment or question is that a large portion of that population reports stigma as being the #1 determinant that causes folks to feel as if they are not part of our community and feel that they are isolated. And we hear this from other communities as well, communities of color. We hear this from the Latinx community. We hear this from the LGBTQ community. When I look at what our government can do, our government can ensure that LGBTQ+ people are properly recognized and respected in every forum that they attend, and making sure that government documents are properly allowing them to acknowledge their identity when they are filling them out. And I would just like to hear if there is an effort to ensure that documentation is updated so that the one thing our government can control, it is working actively to do it, if that is a plan of the Moore-Miller administration, as well as if the county executive wants to pop in as far as what the county is doing in those efforts. Thank you.
Thank you for that and for acknowledging that important subject. So just 3 quick things. In my prior life, I did a tour of a treatment center in Hagerstown with Congressman Trone and now Attorney General Brown. And there was a transgender man there who sat down with me and shared what his experience was like trying to get treatment. And I was shocked. So that's something that has carried with me, and we've talked about as a team very much. I can say the advisory council recommendations to the governor do have a section for LGBTQIA+ treatment and making sure that that is a priority of this administration and that we are meeting the needs of every human being. So yes, for sure. As far as the documentation, the paper, I will be honest with you, I don't know, but that's something I can find an answer to.
From the county's perspective, several years ago, as you know, Delegate, we did make strides in updating our anti-discrimination code to include sexual orientation and gender identity. And we are looking through a lot of our county processes to really improve equity and remove barriers. I also can't speak to every single one of our government forms, but I think it's a good reminder for us to be looking at that. It is certainly the very least that we can do to make sure that people, anybody, whether it's in a job application, whether it's coming into our planning and permitting office, whether it's any time that you need to interface with local government, that our forms are there in a way that recognizes everybody for who they are. So I appreciate the question, and we'll take a look at that too.
And I can add that this week, a member of the Moore-Miller administration heard a presentation from Rissa Watkins where she was presenting on the work that we've done collaboratively with the Frederick Center regarding intake form questions. And so anybody out there who has an organization, we've spent quite a bit of time developing the questions or the fields that in whether it's the government services, but in healthcare services, that are better ways to ask questions and to document that information, and we're happy to share that. But I was pleased to hear that one of the members in attendance at the presentation was from the Moore-Miller administration, the Behavioral Health Administration, and they were very excited to have it, to hear about it, and they've already received the product of our collaborative work together. So there's hope that it will filter its way up and also to be shared then across the local behavioral health authorities across the state.
Thank you. Well, if there's no one else that would like to speak, yes, sir.
Thank you very much for being here this evening. My name is Jason Barth. I'm the executive director at The Ranch here in Frederick County. And I wasn't planning to speak, but I heard several people who spoke of long-term treatment. And I absolutely agree. The need for long-term treatment is absolutely crucial. And I don't know that everyone knows this, but Maryland Medicaid actually does cover this level of care. That's exactly what we do at The Ranch. So I would love to partner with our delegation and with the Opioid Command Center to discuss that, see how we can bring that news out into the workplace, how we can bring it out into reality across the state, because we are doing an amazing job here in Frederick County with the long-term care. Our outcomes are easily 10 times higher than simply going through the detox, rehab, rotating door. And so I would love to engage in that conversation with all of the delegation. And thanks again for being here tonight.
Love that. Thank you.
Just a statement, if I could quickly say it, that may already be a topic of conversation. A little over a year ago, I did lose my mom to an overdose. And I hope there are conversations about pain management programs and being kicked out because of THC in your system. I think that was a significant contribution to what happened. So I just wanted to say that on behalf of Mom.
Thank you very much. I'm sorry for your loss.
Hi, I'll try to keep this brief. My name is Rachel Lambert. I am a peer recovery specialist with Frederick County Mobile Crisis. We operate 24/7 responding to individual defined crises calls. I heard a lot of wonderful things here tonight, and as a person in long-term recovery, I really appreciate panels and meetings like this, so thank you. One of the main reasons that I wanted to ask this question is because throughout the night I've heard repeatedly Medicaid. What are we going to be doing for Medicare individuals, as well as our youth and adolescents? Because we are seeing an uprise, as you all talked about with FCPS, there's an uprise in adolescent substance use, as well as individuals who have Medicare and are just kind of left out. So that's my question.
So 55 and older, in the state of Maryland, all of the age groups for the past rolling 12 months, we have seen pretty much either decline a little or stay the same, but 55 and older has increased, and that we're seeing that really all across the country. So I think you bring an excellent point. I will say, as far as adolescent treatment service, that has been a priority of the Secretary of Health since she took office as well. And it is also a priority that is being made to the governor for the Opioid Restitution Fund money. And a suggestion, all of the localities just got a letter from the Secretary of Health that our office sent out. And the number one priority for the Opioid Restitution Fund money coming locally was asking for them to help invest in youth services. Because we know there's only 3 places in Maryland, no inpatient, and of those 3 places, only 1 takes Medicaid. So we know it's a huge issue, and it's something that we're hoping to work with our local partners on addressing.
Thank you.
Thank you. Well, Frederick County, you guys did not disappoint. Every time I come here, I'm completely blown away by the work that is being done here and your partnerships and passion. I think it speaks volumes how many of your elected leaders came out because their presence matters, and hearing from constituents, and you don't see that in every part of the state. So I feel blessed to be here and to be your neighbor over in Washington County. And I look forward to working with every single one of you. I am always available if you have an idea, if something's going right, if something's going wrong, if you're having an issue, please reach out to me. Our website is beforeitstoolate.maryland.gov. And my email address is just my name, emily.keller@maryland.gov. I'm available all the time, and I look forward to working with you, and thank you for taking an hour and some of your time out this evening. You guys drive safe and have a good night.